Hello everybody, this is Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking about osteoporosis in menopausal women. Let me start with a shocking statistic. 1 in 3 women who are menopausal have osteoporosis. That's a very, very shocking statistic. Osteoporosis is so rampant, especially in our country, that we need this to be detected and diagnosed by all doctors treating women, whether it's a gynac, a CP, an endocrinologist, an orthopedic surgeon. Everybody needs to be alert if the statistics are as high as 1 out of 3 women. So with that, Dr. Chadha, let's begin with the basics. What is osteoporosis?
So as the name suggests, osteoporosis, the bone becomes porous. It becomes brittle and gets holes in it. So 35, 45, 55, 65. As you grow older, now that I said we're living older, there is continuous bone loss. A female is at a disadvantage compared to males for multiple reasons. But here, talking science, they are shorter, they are thinner, they're less muscular, so their skeleton is weaker than a male. Okay. And then add to that a couple of pregnancies, and God forbid if they're having alcohol and smoking. So these are all risk factors. And then the menopause.
What does alcohol and smoking do to osteoporosis?
So these are bone toxins. They actually leach the calcium out. And add to that extra salt in your diet and poor protein intake in most of us. So these are all risk factors why we have so much osteoporosis in our country.
When women come to you, at what age do you see the onset?
So again, I mean, we are looking at 55, 60. It's about a decade earlier than the West.
Right.
But as I was mentioning, the main problem starts in perimenopause, when everyone is fine and hunky-dory, but a lady loses up to 5% of bone mass for the next 2 to 3 years.
So then how does one detect this?
So either if the patient has been unfortunate and had a fragility fracture.
But that's postponed.
No, they can have it any time.
Okay.
So they trip, they slip, and they fall and they fracture.
But I don't need to wait for a fracture to detect it.
Exactly.
So how do I know I have
either we
it?
get a DEXA scan done, or we have certain scores like the OSTA and the FRAC score, which tells us the risk for fracture.
And what are some of the metrics you look at for this score?
So basically it's your age, the sex, previous medical history. Very important is history of osteoporosis or fragility fracture in your mother.
Oh, really?
That's very important. So the genetic factor is there. And on top of that, now we are looking at diabetes as a very serious problem and contributor to bone loss and osteoporosis.
Why does diabetes lead to that? So, like, what is the science behind it?
Yeah, the science behind is when we look at type 1 diabetes, it's because of insulin deficiency and poor nutrition and poor control.
Okay.
Surprisingly, in type 2 diabetes, the bone density on DEXA would be higher than normal, but they're still prone to fractures because of poor bone quality.
Okay, so it's not just the density, but also the quality.
See, in the beginning, when I talked about definition, it was quality and quantity.
Correct.
So both are
equally important. That's where the type 2 would have a different set of issues.
Exactly.
In terms of what it leads to. And what are the risk factors?
In addition, there are certain unfortunate patients who have medical problems, like I said, diabetes, thyroid problems, and certain other endocrine hormonal problems could make them prone to osteoporosis.
What are the endocrine hormonal problems that could make
So if you heard of steroid excess, Cushing syndrome, thyrotoxicosis, hyperthyroidism, overtreated hypothyroidism, hyperparathyroidism. So these are various endocrine glands. When they overfunction, they can lead to osteoporosis.
And what is the best way to manage once a patient comes to you and you've detected them?
Well, once the diagnosis has been confirmed, giving us a DEXA report always gives us confidence, but the FRAC score or the OSTA score also helps us diagnose osteoporosis. Then we look at the lifestyle, calcium in the diet, protein in the diet, and then if the patient is still at high risk of fracture, we talk of specific therapy.
What would that be?
So in terms of therapy, we have two classes of drugs. One which increases bone formation, that's called the anabolic drugs. As of now in India, we have only one example, but we hope to get another one in the next 6 months. And the second class of drug, which is probably very popular, is it prevents further bone loss.
Okay.
So there we have a couple of agents, oral agents, intravenous agent, subcutaneous agents, and all in all, they have made a big difference.
So Dr. Chadha, that was very nice in terms of just simplifying and talking about it in layman terms. Let's listen to your journey, Shobha. How did you meet Dr. Chadha? You said you've known him for 20 plus years.
Yes, I went to him for my hypothyroidism.
Okay.
Way back early in this century. And he told me about, not to trip, fall, even though we were talking only hypothyroidism that time. And in 2004, October to be precise, I tripped and fell in the office.
How did you trip? In the office?
In the office, I tripped and fell. And I landed up in the hospital and then called him and I said, this is what has happened.
But did you get a fracture right away?
I got a hip fracture.
Oh, that can be very
So
absolutely.
Just to give you a little statistics on hip fracture, good old days, hip fracture was equal to a death sentence.
Yes.
And even today, a third of patients don't survive the first year. A third end up not living individually. They are dependent on someone. So that's very scary.
What is the reason for that, doctor?
Even today, I mean, someone would say 30%, someone would say 40%, someone would say 25%. But the fact
all
is,
very high statistics.
these are very high figures because, even though we've got good surgical techniques, these are patients who are elderly and they get into different complications.
Okay.
And that's why they don't see the next year.
Okay, so it's more age related.
Yeah.
That's the reason why. And so you got a hip fracture in 2004.
I was 54 years old at that time.
And then how long did it, how was the
healing
healing
journey? Took me out of
journey?
service for almost 3 months.
Okay.
And I used to go with crutches to the office and work, but thanks to Dr. Chadha, he took me out of that. And there was a injection that I used to take every day. For about 18 months I took that.
18 months for every single day?
Every single day to build up my bone mass.
Okay, and that was, so after those 3 months when you were on crutches,
yeah.
Post that, how has your lifestyle been? Anything that you're doing to make sure?
I used to work 18 hours a day. No sunlight, and that was one of the complaints against me. You have to exercise, you've got to do gymming if possible, but all that I couldn't do.
So then you, after the 3 month...
I started doing yoga, I did a few odd things like that, but not the complete what Dr. Chadha advised, So I went through that. Then I went through another fall that was in 6 years after, in 2010, 2 bones broken on the shoulder.
So here again, let me add that she's always been a very thin, frail lady.
Right.
And that's why at 50, 54 getting a hip fracture is very rare.
Right.
And when we talk in terms of treatment, like I gave her the anabolic therapy for 18 months, and then I gave her the IV injection also, I think 3 years. You reduce the risk of fracture, you don't nullify it.
Correct.
That's not all. I fell another time in the house during the pandemic in 2020.
And where did you fracture this time?
The elbow of the right hand, yes.
Oh my God. And how many months was that in terms of healing?
That was very fast. They put some plates. I'm made of metal, literally.
But all 3 were caused by falls?
Yes, all 3.
So that's why never be in a hurry. Don't walk in the dark. Don't walk if you feel it will be slippery. Have railings in the bathroom. As a matter of fact, in Germany, the rehabilitation centers that are there, they come to your house, they check up simple things. Adequate lighting, no loose carpets, your bathrooms have railings, the wet area is taken care of. So these are very simple things. There's no rocket science in this. But I repeat, you generally fracture only after a fall.
Absolutely.
So if you prevent a fall, and that's where the yoga, the Pilates, good muscular coordination, they become very important.
Absolutely. No, that's very true. And I just want to loop back on this one part of We started the talk by saying, why is an endocrinologist talking about osteoporosis, right? And you told me that, Namita, this has to be not just the prerogative of an orthopedician, but everyone looking at that age group of women needs to be very alert, whether it's a gynaec or whoever. Do you think this is happening in India? Do you think at an awareness level, doctors across specialties are being trained to identify this?
I work at one of the best hospitals in the country, and we did a survey, and we found that patients admitted for fragility fracture, 100% of them should have been on treatment at discharge.
Right.
It was about 20-25%. In spite of all the knowledge, in one of the best hospitals of the country, we had this sort of statistics. So you can imagine what is happening in smaller
elsewhere.
towns. So it's very important to increase the awareness. We do have a couple of our medical societies. So individually, we do look forward to such occasions where we can go and increase the awareness of osteoporosis. Most of us have our hands full, and we are very happy if the public takes care of themselves and don't come to the doctor, at least for this problem.
They get educated.
Yeah, they should. And it's, it's very simple. If you just take care of your diet, you exercise, and stay away from the toxins that I mentioned, you can prevent osteoporosis to a large extent.
Absolutely. No, and this brings us to the end of a fabulous episode. We heard some shocking statistics like 1 in 3 menopausal women have osteoporosis. 1/3 of women with hip surgery don't make it. Why work towards healing a fracture when you can be aware of the condition and prevent one to begin with? When you can work on both the quality and quantity of your bone density. So let's get educated and let's prevent those fractures and let's learn about osteoporosis sooner rather than later. Thank you very much.
बनके उड़ना है तितली